Thank you so much, organizers, for inviting me to this talk. It's a pleasure to be here. Thank you so much, everyone, for making time to be here. So just a bit of a short introduction about myself. I'm Syaqil. I'm currently the UK partnering. So essentially, I work with the British High Commission on a project called UK Partnering for Accelerated Climate Transitions, which stands for UK-PAC short. So with this particular program, we're looking towards supporting projects that supports Malaysia's climate change pledge, meaning to say projects that are focused on renewable energy, green finance, as well as nature. And as mentioned by the moderator kindly, I was the former focal point of the Malaysian Youth Delegation, which is a youth climate change NGO. So yeah, on to my topic for the day. Which is how climate change is increasing the frequency of pandemics. So just a few disclaimers that I'd like to make. Number one, I am by no means an expert on this particular topic. So I have been within the field of climate activism, but it's more of a broad topic as opposed to going into the specific linkage. But I believe this is an important discussion to take place regardless, especially with what's going on in the present state of the world. So first and foremost, I'd like to introduce you to a piece of national climate change policy, or amongst other words, so which is called the nationally determined contributions. So in Malaysia's case, our nationally determined contributions has a health element within it. So specifically within that piece of documentation, what is said is vector-borne diseases such as dengue and malaria are expected to be further exacerbated by rising temperatures and heavy rainfall. So the dengue menace in urban centers has been a constant public health challenge affecting a wide population of all age groups in Malaysia, and this is expected to worsen with the impacts of climate change. So with regards to how all these factors increase cases of dengue and malaria, we've got the explanation below. So studies reported that rainfall can lead to increases in dengue fever transmission, as rainfall creates abundant breeding sources for Aedes. And when we're talking about areas of lower altitudes, where malaria is already a problem, warmer temperatures will alter the growth cycle of the malaria parasite, the mosquito, enabling it to develop faster. I think it's important to reflect here that in the midst of extreme weather, in the midst of global rising temperature, it's critical to note that climate change does have links to future pandemics. So moving on to, I guess, a bit of a more global perspective, if we're looking at linking climate change to the realm of public health, let's look at what the World Health Organization has communicated. So intuitively, the social and environmental determinants of health are essentially basic needs in life. So we're talking about access to clean water, clean air, food security, and shelter. And from 2030 to 2050, as a result of having less access to these basic needs in life, the world will be experiencing an additional 203,000 deaths per year as a result of amongst malaria, heat stress, diarrhea, and malnutrition, amongst other things. So although global warming may bring some localized benefits, such as fewer winter deaths in temperate climates and increased food production in certain areas, the overall health effects are overwhelmingly negative. And research from Harvard actually suggests that actions needed to tackle climate change are also actions that will make people healthier. It's important that we actually link health and environmental policies and not have them separated. So just to, I guess, take a step back and sort of reflect on the present pandemic that we are in the middle of at the moment. Let's look at the parallels between climate change as well as other infectious diseases on top of COVID-19. So what's important to note is the crossing of species barrier happens due to wildlife trade, and that can actually be attributed to the COVID-19 pandemic. As a result of over-exploitation of resources at the current state, there is bound to be higher prevalence of species barrier crossing, leading to more frequent rise of new and deadlier diseases. The COVID-19 pandemic is actually showing us a real-life lesson that nature has over civilization and its politics. We cannot look at climate and environment and health as separate entities. That is a dangerous delusion. The idea that climate policy today is indivisible from preventing new infectious outbreaks must be put out. Again, they are all linked and they are closely interdependent with each other. So according to the One Health Institute, an interdisciplinary epidemiological program at the University of California, Davis, global health policymakers need to consider the health ramifications of climate, habitat, and land use strains, and how they all lead to disease. Because let's just face it, over the past few decades, the major epidemics we've been experiencing, such as Ebola, SARS, and the Nipah outbreak have all resulted from the virus jumping from wildlife onto people. With regards to the ways climate influences emerging diseases, we've got 3 points that need to be taken into account. So number one, most major human infectious diseases result from us being exposed to novel pathogens that originate from animals. As mentioned earlier, this is a result of the crossing of the barrier species that can be attributed to land use, and this includes deforestation, introduction of farming, development of resource extraction in what is otherwise natural settings. So number two, it's vector-borne diseases. So the lengthening of seasons and increase in geographic reach of disease-carrying insects can be attributed to global warming. So mosquitoes and other warm weather vectors can migrate to higher altitudes and areas further away from the equator as a result of rising temperature. An example to drive the point home is within the United States, actually, where the lengthening of seasons for Zika-carrying mosquitoes is actually attributed to a rise in temperature. The final point is attributed to places of, I guess, very low temperatures, such as in the Arctic. So research has actually shown that the thawing of ice layers due to particularly warm years possibly lead to the circulation of the anthrax contagion. So the anthrax spores can be released from infected animal carcasses, which is an infectious disease. So I guess to illustrate the sort of effects, climate change or climate-related factors may have on future diseases, we've got 2 case studies that I'd like to share with you. So number one, it was a case study in Panama, which was in 1999, involving the hantavirus pulmonary syndrome. This was essentially a fatal lung disease transmitted through the saliva, feces, and urine of rats, which appeared in the country in 1999 for the first time. So in that year, the country experienced thrice as much rainfall, which led to the explosion of the rat population. Because of this, exposure to populous human settlements meant that diseases the rats were carrying were more easily transmittable. So the next case study is one that it hits closer to home, which also happened in 1999. So the Nipah outbreak was as a result of anthropogenic fires in Indonesia, as well as drought. This pushed bats outside of their natural forest habitats. And these bats then roosted near a hog farm where its urine, along with pieces of food they were gorging on, dropped into the pigsties. So when the hog consumed those droppings, it became a carrier for the outbreak, as it was eventually slaughtered and infected the market it was brought to by the man handling the meat. Eventually, 105 people succumbed to the virus. So, looking into the future, it's I just want to reiterate from the above. As far as emerging contagions are concerned, general consensus is it's attributed to land use change, predominantly farming as well as feedstock. But at the end of the day, to feed people. So over the next 35 years, the global population will soar beyond 10 billion, and this will put further strain on our land as we have to feed more people. At the moment, more than 1/3 of the planet's land surface and 3/4 of all its fresh water go towards cultivation of crops and raising of livestock. These are the places where infectious diseases spread most often. As with the COVID-19 pandemic, the introduction of vaccines is not the end of the story. What needs to be focused on is how governments manage restrictions on social behavior. Looking into the future, it is highly likely that restrictions will continue, albeit a little more tolerable, and hopefully more effective. Taking this into account, the idea of going back to normal seems distant, but what can be done is to shift to a new norm in order to get ahead of potential future pandemics. Workplaces will continue to have strong elements of remote working, and international travel will likely remain under scrutiny for a while. Not to mention that the new normal will probably involve intermittent lockdowns to curb potential spread of infectious diseases. Taking all of that into account, it's obvious that as far as individuals are concerned, there are steps that we need to take, but looking at it from a global perspective, there are also actions that can be taken to address this. We're looking at transitioning towards clean energy, for instance, as well as adapting more public transportation as well as active movement. It's important to note that it doesn't only cut carbon emissions, but it also helps to reduce air pollution. So in 2015, the World Health Organization recommended a work plan on climate change and health. And these include as such partnerships, which is to coordinate with partner agencies within the UN system and ensure that health is properly represented in the climate change agenda. Number two is awareness raising, which is to promote and disseminate information on the threats that climate change presents to human health and opportunities to promote health while cutting carbon emissions. Third one is science and evidence, just to coordinate reviews of the scientific evidence on the links between climate change and health and develop a global research agenda. Last but not least, which is to support implementation of public health responses to climate change, whereby we'll be looking at assisting countries in building capacity to reduce health vulnerability to climate change and promote health whilst reducing carbon emissions. So that's pretty much it for my slides. And I guess if I could just share some final reflections from what I've just shared to you. I think without wanting to dampen everyone's spirits too much, I think within the next decade, within the next 10, 20, 30 years, I think it's important to note that, climate change and the climate crisis is a crisis that we will live through. And as far as future pandemics are concerned, based on the links that climate change has with future pandemics, I think it also goes without saying that we'll be facing more of this as a result of climate change. But it's important for us to remain hopeful. It's important for us to remain hopeful because the COVID-19 pandemic has shown that there are solutions. Whether they are long-term solutions or short-term solutions, we have yet to find out. But as a human population, we tend to adapt, and whether we like it or not, this is something that we have to go through. And I believe we have the capacity as a human race to do it. Yeah. Thank you so much for your time.